Welcome to the deep dive. Think about this for a second. What if a really simple health check, one you can get nearby, could make a big difference in stopping major health problems in your area? Today, we're digging into exactly that. We're looking at cholesterol testing. Our source is an article called Cholesterol Blood Test in Crawley, your local health check, from the Blood Test UK website.
Right.
And we want to figure out why these tests are, well, so important for staying healthy, and also the pluses of getting tested right where you live, like in Crawley.
It really is interesting how just being proactive, getting regular checks can empower you and actually, boost the health of the whole community.
That's a great point. And it takes us straight to why checking cholesterol is, well, super important for keeping our hearts healthy.
It absolutely is.
The source points out that keeping an eye on cholesterol helps stop big problems like heart disease and stroke. These are major worries here in the UK. It's about knowing your numbers so you can make smart choices about food and moving your body before things get serious, like a little checkup for your heart.
Exactly. And knowing your own specific numbers, your lipid profile, means you can make changes that actually work for you. It's not just general advice, it's understanding how your diet, your activity level affects your body. That way you can hopefully head off problems. It's incredibly valuable.
So how often should we be thinking about getting checked? What's the general advice?
Well, the usual guidance is for most adults over 40 to get checked about every 5 years.
Okay, every 5 years for over 40s.
But, and this is important, that can change. If you have other health things going on, like diabetes, or if you're carrying extra weight.
Or if heart problems run in the family.
Yes, exactly. Or family history. Then you might need tests, more often.
So it really depends on the person.
Absolutely. You really need to chat with your doctor to figure out the best plan for you personally.
That makes sense. And that leads nicely into the benefits of local testing, particularly somewhere like Crawley.
Right. The source really highlights this. For people living in places like Crawley, having clinics nearby isn't just convenient, though it is that too.
Easier appointments, shorter waits.
Often, yes. Compared to maybe bigger hospitals or centers further away, quicker access is a definite plus.
And the source mentions something else about local care. Something about doctors knowing the area.
Yeah, that's a key point. Local healthcare providers, the ones in Crawley, often have a better feel for the specific health needs and sort of trends in that community. This can mean they give advice that's, well, more tailored, more effective for the people living there.
And building that relationship with a local doctor, that helps.
Definitely. It builds trust. And when you trust your local team, you're more likely to stick with testing and follow the advice. The article suggests that in Crawley, they've actually seen fewer heart problems when people test regularly and follow through. It benefits everyone.
Wow, that's a real community benefit. Okay, so what about the test itself? What actually happens?
It's pretty simple, really. Just a quick blood draw from your arm.
Do you need to do anything beforehand? Like not eat?
Yes, usually you need to fast. That means no food or drink, just water, for about 9 to 12 hours before the test.
Got it. 9 to 12 hours, just water. And then you get your results.
Yep, usually back in just a few days. Your doctor will then go through them with you. They'll explain your total cholesterol, the good kind, HDL, the bad kind, LDL, and also triglycerides, another type of fat in your blood. Think of it like a report card for the fats in your blood.
A report card, I like that. Simple. So what if that report card isn't looking so great, if your numbers are high?
First thing, don't panic. There are simple steps you can take. The source talks about focusing on healthier eating.
Like what? More fruits and veggies.
Exactly. Fruits, vegetables, things like oats, nuts, healthy fish, olive oil, and trying to cut back on processed stuff and greasy foods.
Makes sense. What else?
Moving your body more. Aim for about 150 minutes of activity that gets your heart rate up a bit each week. Brisk walking, cycling, swimming, that kind of thing.
Okay, eat better, move more.
Yeah.
Anything else?
Finding ways to chill out can help too. Stress can actually push cholesterol up sometimes. So things like yoga or just some deep breathing exercises might make a difference.
Right, manage stress. And sometimes doctors might suggest medicine too.
Yes. Sometimes medication is needed to help get those numbers down. That's another conversation to have with your doctor.
Okay, so for people listening, especially in or near Crawley, where can they actually go to get these tests done?
Good question. You've got options. Your local doctor's office, your GP surgery, is usually the first port of call. There are also private clinics in Crawley, and even some pharmacies offer cholesterol checks now. It's best to call ahead and just check what they offer.
Right, check first.
Yeah.
And what about cost?
NHS tests are generally free if you meet the criteria. Private tests, well, they vary, maybe somewhere between 20 and 100 pounds. And it's always worth asking if your workplace offers any free health screenings too. Sometimes they do.
Good tip. Okay, so let's wrap this up. Basically, getting your cholesterol checked regularly is a really smart move for your heart health. And using those easy local options, like the ones available in Crawley, makes it simple but powerful. It helps you know what's going on and take charge of your health.
It really does. It's about staying informed for a healthier, longer life.
A simple step with big benefits.
Precisely. And this deep dive was inspired by that article, Cholesterol Blood Test in Crawley, your local health check on the Blood Test UK website. So thinking about how easy local testing can be, maybe ask yourself, what's one small thing you could do this week to look after your heart health right there in your own community?